Nearly 1 in 4 Americans live with a disability, and for some, that means having a compromised immune system and a higher likelihood of getting the coronavirus. Advocates are now sounding the alarm that Congress needs to do more to help society's most vulnerable. I spoke about this with former Pennsylvania Governor and former Homeland Security Secretary Tom Ridge. He's now the chairman of the National Organization on Disability. And Danny Woodburn, an actor and a disability rights activist. We began our conversation by discussing how those with disabilities are affected in this pandemic.
First of all, I think there's a fear around going in. Obviously, this community is more at risk, but also there's the notion that decisions might be being made with regard to the quality of life and whether or not a person's quality of life is worth saving. So, and we talk about advocacy, for example, having an advocate in the room for people with disabilities, especially somebody with, say, Down syndrome, who has to go in and can't have a family member there or a person who's been taking care of them, working with them over the years to help them make decisions about their medical care. So this puts them more at risk. And there's policy being looked at now that is a bit scary to people with disabilities, that determinations are being made, like who gets a ventilator based on, physical and cognitive ability, how the virus might have been affecting them, and whether or not they get to keep a ventilator.
Governor Tom Ridge is somebody who's been involved with the disability community for a long time. Are these issues that have been discussed in the past, or is this something that is just now for the first time being thought about seriously?
One of the challenges that Danny and I and the broader disability community organizations are dealing with is that we've made modest changes and very important and positive changes since the passage of the Americans with Disabilities Act 30 years ago. This is the 30th anniversary year of ADA. But what has happened during the COVID crisis, during this pandemic, is we're seeing that for the first time in 30 years, we don't have a seat at the table. There have been several rescue packages coming from Washington, D.C. And appropriately, they're trying to reach out to those who are most affected by it and trying to reach out in economic terms and trying to help people through this very difficult period. We've had 15 or 16 disability organizations write to Congress, write to the leadership, and saying, we need some more support for home and community-based health care. We do not want to be discriminated against as a population, and people with disabilities have lost a much higher percentage of their jobs. We haven't really been at any advantage or any focus put on us by the public policymakers. When you talk about vulnerability, you talk about poverty, you talk about minorities, but the disability community is never mentioned. And we think it's time to focus on that because we don't want to roll back the gains we've made over the past 30 years as a result of the COVID crisis.
Governor Ridge, a message of hope?
There certainly should be a message of hope. Ironically, Americans without disabilities have been living in many cases in isolation without a great deal of contact with the rest of the world. For a large number of men and women and children with disabilities, that's how they live, and it's impacted the quality of their life. And they have the same aspirations of those without disabilities. And so one of the ironies of this isolation is I'd like to think there's greater empathy and understanding of how people with disabilities live and work and deal with their personal and family situations. And hopefully during this crisis, there's a greater appreciation in the broader community how valuable they are and how important they are to be integrated and become much more a part of our broader community.